Friends, welcome to Time with Thebsian. Today we are thinking and discussing about the consumer protection in the use of medical devices. About consumer protection, there is a law that was passed in 1986. That is the basic law, and later on, after 1986, so many updates have been passed in the parliament to strengthen and give a broad nature to the consumer forum and protection law. As far as the medical devices are concerned, there are about 2 lakhs in number, and among this number about 40 to 50% are coming under class 1 devices where there is no regulatory registration is necessary for manufacture and sale. So here only the owners of the manufacturer is responsible for the safety of the product. As consumers of the medical device, each one of us may not be able to name more than 5 to 10 medical devices. We are not sure what our medical devices are used to in the treatment of our medical conditions. Legally, when the doctor is prescribing a medical device, he has a responsibility to tell us that he is prescribing a medical device and the purpose and the safety regarding the medical device. So we have to be careful regarding the safety as customer who is paying for medical device as we pay for drugs. We have to be aware about our rights as consumers of medical device. It is not like getting duplicate coconut oil or kerosene in the market because they don't directly affect our life. So we should know that what is a medical device. Medical device is as good as medicine. By now we know what is a medical device, and the history of medical devices should be traceable to the end user, supplier and the manufacturer. As a consumer of medical device, we have a right to safety, a right to information, a right to choice, a right to be heard by the legal authority, a right to be redressal, and right to consumer education by the manufacturer or the regulatory authority. The right to safety. When a physician decides to use a medical device on a patient, physician has the duty to assure the safety to us or the patient because we are consumers who are paying for the service. Physician is under a medical oath that he will use a medical device by informed consent. Other, it becomes a negligence of service. The physician has to brief the patient regarding the purpose of the medical device and the benefit that we are going to get over by using that. He has to describe the working of the device to the consumer and assure him that the use of this medical device is for the betterment of his life. He can give references to the previous patients whom he has treated or who is already under the care and use of the medical device. And we know now, take the case of heart valve, there are large number of heart valves in the market. So the physician has to give a right to the patient, a right to the choice, selecting the device. The physician has to teach the patient, brief the patient regarding the availability of different models, the cost of different models and the benefit of each models, and which will suit him for what reasons. And the physician cannot give a lecture and forget about the device description. He has to hear the patient or the consumer, clear his doubts. So there is a right for the consumer, right to hear, heard by the physician. And if the physician is not listening, even after the use of the commodity or medical device, the patient has questions, he has to be heard by the physician. And the physician is not listening, the patient can go to the consumer court or a higher authority for hearing. If the patient finds out that his physician has not done right to him as a consumer, he has got a right for redressal of his grievances. He has to be heard, and if there is a compensation, if there is a negligence, it has to be heard and decided by higher authority. And if negligence is proved, there has to be a compensation given. Now we think about consumer education. The consumer forums has the convenience or the time for consumer education. The manufacturer will print a note or a brochure on each device. That is his role of consumer education. His representatives will brief the physician regarding the medical device, which forms the foundation for the knowledge of the physician regarding the medical device, and the physician has to educate the patient who is a consumer. So it becomes an onus of responsibility of consumer education to the manufacturer, to the physician, and to the seller. And if there is any negligence or the complaint regarding the working of a device, there is routes of complaint. They can register the complaint with the doctor, then with the hospital or the end use. Then if they are not, if both are not cooperating, they can go to the courts. The consumer courts are available in each district and states. District courts decisions can be appealed in the state courts. There are many laws has been passed by Parliament for quality control, for safety control, for consumer education and consumer redressal. So the latest update has come in 2019. And in the case of medical devices, separate conditions and supports rules are coming up recently, but the old Consumer Protection Act of 1986 is very relevant because broadly it covers the protection of a consumer, whether he is buying kerosene, whether he is buying drugs, whether he is buying any product in the market, including medical devices, though not specifically detailed or mentioned. Dear Thebsians, dear friends of Thebsians, kindly be with me on next Friday too. We will discuss another topic on medical devices.